As more female physicians enter the workforce, they face persistent challenges that can lead to burnout, including pay inequities, discrimination, and an imbalance between responsibilities at work and home. To tackle those issues, 6 leading healthcare associations, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Hospital Association, and the American Psychiatric Association, funded by a grant from the Physicians Foundation, have formed a partnership that brings together early to mid-career female physicians for networking, mentorship, and leadership training. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer in AHA's Washington office, and your podcast host. In this podcast, our Vice President of the AHA's Physician Alliance, Elisa Arispacochaga, talks with women's physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program.
Welcome to another in AHA's ongoing series of podcasts where we focus on important issues facing clinician leaders. I'm Elisa Arispacochaga, Vice President of AHA's Physician Alliance, and today we're talking with women physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program. AHA's Physician Alliance joined a consortium of 6 organizations, including the American Academy of Pediatrics, the Academy of Family Physicians, the College of Physicians, and the American College of Obstetricians and Gynecologists, as well as the American Psychological Association, to develop a program to address wellness and leadership needs for women physician leaders over the next 18 months. Joining me is Janine Adjo, Vice Chair of the Department of Pediatrics and Director of the Pediatric Residency Program at SBH Health System in the Bronx, who was nominated to participate in the WEL Grant Program. Welcome and thanks for talking with me today.
Thank you so much for having me, Alyssa.
So to get us started, why don't you tell me a little bit about yourself and your organization?
My name is Janine Adjo. I am a pediatrician by trade here at St. Barnabas Hospital. I am vice chair of the department here, and I first started having interest in medicine, I think, a long time ago. I was a 5-year-old child thinking about what I wanted to become, and medicine stuck in my head. And through a series of experiences, I kind of whittled it down into what kind of physician I wanted to be, and pediatrics came about. I did my residency at NYU and then actually came to St. Barnabas as my first job right out of residency and have been here ever since, almost 17 years.
So what convinced you or, pushed you to pursue a leadership role in the hospital rather than stay at that, treating patients stage? Why did you want to move beyond just seeing patients?
I think it's a twofold answer. Leadership is something that actually fell upon me, as well as me seeing things and seeing how things operated in the clinics and in the hospital that I was employed and wanting to make policy changes. So I think because as a clinician, I had ideas to improve certain aspects of the clinical day with the patients and to improve certain aspects of the physician's role at the hospital, I was chosen to do many different things in different committees, and that led me to more leadership positions within the hospital and within the department.
So how would you describe your leadership style? And do you have either some specific experience or a series of mentors who played a really formative role in defining that style?
Leadership, I think it happens. I think it's not something that you can follow someone into. I think you can definitely take advice from different leaders on how to be a good leader, but I think it's something that actually is within you. I think I'm more of a collaborative leader, meaning that I see a vision, I have a vision, or I am able to see others' visions, and then I like to get stakeholders involved to further that vision, to implement the vision, to follow up on the vision. So that's the kind of leader I am. My role models, it's very interesting. Over time, I think my first role models were my parents. They taught me about hard work. They taught me about commitment. They taught me about seeing things through. And then as I moved throughout my life and my career and my experiences, I think I looked for mentors that had those same goals, those same visions, those same initiatives and hard work and commitment and seeing things through. So throughout my life, I've been able to have mentors that I've actually taken pieces of who they are as leaders and implement that into myself as a leader here at St. Barnabas.
With the increasing number of women entering medicine, and I believe we've now well past the point where there are more women enrolled in medical school than men, what are those workplace inequities that you really see as the most important or the key ones to start with for the profession to address?
Right. And so I agree with more and more women entering the medical field. And as you stated, in medical school, we're actually now the majority. Now there are a few things that I see that are a little bit concerning to me. One, the number of women in leadership positions. There was actually an article in the Harvard Business Review that talked about the limited number of women that are actually CEOs of Fortune 500 companies. And I think that actually correlates to hospital administration too. So I'd like to see more women in leadership positions. We have so many ideas, and because we wear so many hats, we are career women, we are family women, we have a lot of different things that we do throughout our days, and so much of what we do can contribute to those leadership positions. We know how to task, we know how to organize, we know how to schedule, we know how to put people in certain places so that they can make change and institute transitional changes and do certain things. So I think there's so much that women have to offer just from our life experiences as leaders, so that I hope that more of us move into leadership positions. I see many women, even in my own sphere, who I could definitely see in leadership positions, but fear holds them back from taking that opportunity. They're so afraid they're going to fail. And I want to actually do away with that notion, because we're all going to make mistakes. We're all going to have failures. And I want women to realize that they're going to learn from those mistakes. They're going to learn from those failures, and they'll move forward and they'll move on. And then second, I think pay equity is huge. I think women will step into the same role as a male that held that position prior to them and will not get compensated in the same fashion as that male did. And I think that has to be done away with. We should be valued just the same way as our male counterparts are valued, and that value should come in an attitude of gratitude as well as in the compensation.
I think that's very true. And I especially am pleased that you pointed out that fear of failure. I think it is something that occasionally holds some women back, and just getting past that point, understanding that you will make errors and you will move on and the world will not end when they happen.
Exactly. And in fact, you might improve the world because of that one failure.
So I know as part of the work with the WEL grant, you're working on this concept of using leadership training as a tool to prevent burnout.
Mm-hmm.
How's it going so far? And what are your own strategies for preventing burnout and really maintaining your own well-being while being a mother and physician and the vice chair and I'm sure 20 other things on your list?
So far, this WEL project is amazing. We've had one in-person meeting so far, and we've had 2 webinar seminars so far, and each one of them have their distinct learning point. Our last webinar was about change and transition, and that was extremely helpful because taking over as vice chair, there's a lot of moving pieces in my department. And because of that, there are a lot of changes that often have to take place. And having to move your department along on the avenue of change can be difficult. So some of the webinars have been very helpful in terms of helping me establish my leadership role here at St. Barnabas. Now, in terms of preventing burnout, I think one of the best things that you could do is provide physicians an opportunity to voice their concerns and voice what's going on with them, because your burnout might be different from my burnout. What causes you to burn out might be different from me. And so I think it's very important that we don't have like a one approach to everything, that we actually expand it and think, okay, what is helpful for this particular woman to prevent her from burnout or not having as much enthusiasm about going to work? And I think for me, taking on different challenges has definitely helped me avoid burnout. I see every day as a potential to further my purpose. What am I here for? What did God put me here to do? And I see every day as a means to determine what is that purpose. And so by taking on the role of program director or now vice chair, or I'm also now in the admissions committee for CUNY School of Medicine. So by taking on different roles, it actually keeps me interested. It keeps me motivated. It keeps me finding ways to improve certain things and change policy. And all of those things help me prevent burnout. In addition to having a great family, I have a great husband and I have wonderful children and an extended family that also prevent me from being burned out, because I look to them for my joy and my happiness and just an overall sense of well-being.
Most people would not say, please give me more work that will affect my burnout. But I completely understand. It's keeping you engaged and involved and getting to make a difference, which is what drives you.
Exactly.
I think that's excellent. And I agree. Each person needs to find what that is for them. Just to wrap up, tell me a little bit about what makes you hopeful about the future of medicine.
Well, I have to tell you, I now sit on the admissions committee for the CUNY School of Medicine. And as part of that role, I interview incoming medical students. And I have to tell you, they keep me hopeful. This particular school is a combined program. So they actually accept students at the age of 17, and they get their bachelor's as well as their MD. And these students are phenomenal. They have accomplished so much in just 17 years of life, and their outlook is so optimistic. And the things that they want to do, the things they want to change are just phenomenal. I'll give you an example. I interviewed a young lady last week who was telling me that she's from an underserved population herself. And one of her goals as a doctor is that just as cops are being asked to live in the communities that they police, she felt that doctors should also live in the same community that they serve, so that this way they actually understood the social determinants of health that their patients face. And I thought that was such an interesting point of view, so that the kind of ideas that the medical students of the future are coming up with to help ensure health and wellness in their patients, I think that makes me excited. I think now the focus that we have also on physician wellness and physician well-being also gets me excited, because people are realizing that doctors are people too, and they actually need support as well. The future of doctors that are coming out of the pipeline, and also what we're doing to ensure that the doctors that are in the pipeline are doing well, these two things excite me a lot, and I'm really excited about the future of medicine and where it's going to go. In addition to a lot of the technology that has come out and a lot of the research that we've been doing on gene therapy and different modalities of treatment have also excited me. So I'm just excited to see where medicine goes and see what the generation behind me does with the tools that they have now.
That's wonderful. And with future doctors coming from the stock of that woman that you described, I think we're all going to be in great shape.
Definitely.
Well, thank you so much for joining me. I really appreciate hearing a little bit about what you've been doing. And thank you to everyone listening today.
Thank you so much, Alyssa.